Let me ask you something, and I want you to be honest with yourself. Are you active or are you just busy? Because there is a massive difference between the two, and confusing them may be one of the biggest reasons you haven't been able to lose weight and keep it off. I'm Dr. Greg Oliver, and in this lesson, Factor 2 of my 5-factor approach to medical weight loss, we're going to talk about exercise, real exercise, what it actually is, why it is absolutely essential to your health, and most importantly, how to start right where you are without burning out in the first 2 weeks like you may have done before. Here's something I see in every single day in my practice. Patient tells me they're very active, and they mean it. They genuinely believe it. They're running kids to school, working on their feet, doing errands, maybe hitting 10,000 steps on their Fitbit. But here's the truth. Busyness is not exercise. Let me define both clearly. Activity is simply movement in your daily life. Walking through the parking lot, standing in the kitchen, taking the stairs. It burns some calories, and it's certainly better than sitting all day, but it does not produce physiological adaptations your body needs to fight disease, lose fat, and live longer. Exercise is intentional, structured, repetitive physical movement performed at a sufficient intensity to create a training effect in your body. It elevates your heart rate. It stresses your muscles. It triggers hormonal and cellular responses that change the biology over time. And here's the uncomfortable truth. Many of my patients who wear step counters and claim 10,000 steps a day still cannot walk a sustained 20 minutes without stopping. The steps are real, the exercise is not. We have to stop giving ourselves credit for busyness when what our bodies need is intentional movement. So, why does this matter so much? Well, I'm going to give you the science, because this is not just about the number on the scale. Exercise may be the single most powerful medicine we have. Number one, it fights inflammation. Chronic low-grade inflammation it's the root of obesity, diabetes, heart disease, and even certain cancers. Regular exercise significantly reduces inflammatory markers in the blood, including C-reactive protein and interleukin-6. Your body actually becomes less inflamed at the cellular level. Number two, exercise builds muscle and strengthens bone. After age 30, we lose muscle every decade if we do nothing about it. Less muscle means slower metabolism, more fat storage, and greater risk of falls and fracture. Resistance-based exercise, even like walking uphill, signals your body to build and preserve muscle and maintain bone density. This is critical for long-term weight management. Number three, it protects your heart. Exercise strengthens the cardiac muscle, lowers resting heart rate, reduces blood pressure, improves cholesterol profiles, and increases the efficiency of your cardiovascular system. People who exercise regularly have dramatically lower rates of heart attack and cardiovascular disease. Number four, exercise reduces our stroke risk. Studies show that regular moderate exercise can reduce your risk of stroke by up to 27%. It improves blood vessel flexibility, reduces clotting factors, helps regulate blood pressure, all of which are major stroke contributors. Number five, it sharpens your mind. This one surprises people. Exercise increases blood flow to the brain and stimulates the production of BDNF, brain-derived neurotrophic factor, which has been called Miracle-Gro for the brain. It improves memory, focus, reaction time, and our mood. It reduces anxiety and depression as effectively as some medications. It may even slow cognitive decline and reduce Alzheimer's risk. Number six, exercise improves insulin sensitivity. It makes your muscles better at absorbing glucose from the blood without needing as much insulin. For anyone with prediabetes, type 2 diabetes, or metabolic syndrome, this can be transformative. Number seven, regular exercisers fall asleep faster, sleep deeper, wake up more rested. And better sleep in turn regulates the hunger hormones, ghrelin and leptin, which means you have fewer cravings throughout the day. Number 8, It extends your life. A landmark study in JAMA found that higher levels of cardiovascular fitness were associated with dramatically lower mortality from all causes. Fitness is one of the strongest predictors of how long and how well you will live. Studies show that 150 minutes a week of moderate, sweat-producing exercise can reduce the risk of dying from all causes by 47%. 300 minutes of the same type of exercise per week can reduce the risk of dying from all causes by 53%. There's no medication that can do that. Exercise is not a punishment for what you ate. It is the most comprehensive health intervention that exists, and it's free. Now, here's where most doctors, trainers, and well-meaning fitness influencers get it completely wrong. They take someone who's been sedentary for years, is overweight, someone who's completely disconditioned, maybe they're even 50 or 100 pounds overweight, their joints ache, their energy's low, and say, let's get you into CrossFit, let's go to spin class, let's do an hour a day. And I want you to understand, that patient is now set up to fail before they walk through the door. Their joints can't handle the impact. Their cardiovascular system's not ready for that. Their nervous system has no movement patterns even built in. They get sore, they get injured, they feel humiliated, and they quit. And they feel like they're a failure when in reality it was the plan that failed them. Aggressive exercise programs are designed for already fit people. They're not entry points for someone just beginning their journey. I have a different philosophy on this and 20 plus years of patient outcomes to back it up. Example, a 58-year-old overweight patient who worked a desk job came to me due to fatigue, shortness of breath, foot and knee pain, and trouble sleeping. After ruling out any significant underlying medical disorders, I told him he was out of shape, overweight, and wearing his body out with disuse. He could barely walk to the mailbox at the end of his 100-foot driveway, so he let his wife retrieve the mail every day. We started there. I had him go to the mailbox every day and back 7 days a week. After 4 weeks, he said that task had become easy for him. Next, I had him walk to the neighbor's mailbox and back daily. Every few weeks, we extended the number of neighborhood mailbox he would walk to and back from. He persisted as he saw some progress. After a year, this gentleman had lost 30 pounds, was jogging 2 miles a day. Persistence, patience, and consistencies will win out every time over time. And you can do this also. We start with where you actually are, not where you think you should be, not where you were in college or in high school, where you are today. And there's absolutely no shame in being a beginner. That means starting with a 10-minute walk. Just 10 minutes. That's it. But Dr. Oliver, that can't possibly make a difference. I hear all the time. Here's what I tell my patients. 10 minutes of intentional walking is more exercise than you did yesterday. And that's exactly the point. Then every other week, we increase either the distance or the intensity by just 10%, not both at the same time, one or the other. So at week 3, maybe you're walking 11 minutes. Week 5, 12 minutes. Maybe in a few weeks, you pick up the pace just slightly. Maybe next, you add a small incline. In 1 month, the progress seems modest. But look where you are in 6 months. Look where you are in a year. Patients who started with 10-minute flat walks are now doing 45-minute brisk walks with hills. Some are jogging like my previously mentioned patient. Some are doing strength training they never imagined. The 10% rule works because it respects the physiology of adaptation. Your body changes gradually. Tendons and ligaments adapt much more slowly than cardiovascular fitness. Joints need time to adjust to new loads. The 10% rule keeps you in the zone of challenge without tipping you into the zone of injury. Now, for those of you who are already exercising, maybe you walk or go to the gym occasionally, we're not starting from zero. We're starting from you. But we are starting to make you more consistent and going to apply the same 10% rule to push your program forward. Consistency for a seasoned exerciser is often the missing ingredient. Here's my guiding principle. What you accomplish in a month will not impress you. What you accomplish in a year will absolutely astound you. I want to leave you with one concept that I share with every single one of my patients because it changes the way they think about all of this. Your weight is primarily determined by what you eat, but body composition, your silhouette, your shape, your muscle to fat ratio, how you look and feel in your own skin, that is determined by what you do. Diet and exercise are not competitors, they're partners. You need both, but they do different jobs. Eating well will move the scale. Exercise will transform the body underneath, and together they reduce body fat percentage, protect lean muscle, and create the sustainable, healthy physique that no diet alone can ever produce. This is not a 90-day challenge. This is a life you're building, one intentional step at a time. So here's your assignment this week. Be honest with yourself about where you actually are. Not where you want to be, where you are. Then take one walk, just 10 minutes. Intentional, focused, purposeful movement. No phone scrolling, no stopping to chat, just you moving your body with purpose. Do it tomorrow, then the next day, then the day after. Make it a non-negotiable part of your day the way brushing your teeth is. Because the goal is not a workout, the goal is habit. A new identity, someone who moves every day because that is simply who they are now. If you found this information helpful, please subscribe to my channel. There are 3 more factors in this series, and each one builds on the last. And drop a comment below. Tell me where you are, starting with your exercise plan. I read every one. Let's build something extraordinary, one step at a time. Thanks for listening. I'll talk to you soon.